Bad news, worse delivery, a lesson in empathetic communication in the healthcare setting. Let's begin. Hello, I am Treasure Wiggins, a Year 4 medical student and the narrator of this video case presentation. This is Dr. H, a gynecologist working at the Mount Hope Women's Hospital. Lastly, meet Emma, our patient, a 32-year-old female from Valsaine, Trinidad. She'd recently had a routine pap smear and came for a follow-up visit at the Mount Hope Women's Clinic. I brought Ms. Emma into the doctor's office, placing her file on the desk and offering her a reassuring smile. Hi. My name is Treasure, and I'm a medical student working with the team today. I'll be here to assist during your visit. She seemed relaxed, even a little casual. I assured her, the doctor will see you shortly, and stepped back, observing from the side of the room. After about 5 minutes, the doctor entered the room, holding her phone to her ear. She quickly said into the phone, "I have to go. I'll call you back after post-op rounds," and hung up before turning her attention to the file on the desk. Without much of an introduction, the doctor said aloud, almost to herself, "I've got post-op rounds in 30 minutes, before sitting down and turning to Ms. Emma. Flipping through the file, she finally began, "Your pap smear results came back abnormal. It shows precancerous changes, what we call high-grade squamous intraepithelial lesion. We'll need to schedule a colposcopy to take a closer look and possibly treat it. Any questions for me?" Ms. Emma froze, her calm demeanor replaced by visible confusion and fear. After a long pause, she asked hesitantly, "Does this mean I have cancer?" The doctor responded quickly, "No, but it could become cancer if left untreated," before glancing at her watch and moving on to talk about scheduling the procedure. The entire conversation lasted no more than 5 minutes. As the doctor stood to leave, Ms. Emma sat silently, her face a mix of shock and anxiety. She seemed to have more questions but didn't know how to ask them. The rushed and impersonal delivery had left her overwhelmed and unsure of what her diagnosis really meant. What went wrong? Firstly, the doctor entered distracted. The doctor came into the room while still on a phone call, quickly ended it, and immediately mentioned having limited time due to post-operative rounds. This created an impression that Ms. Emma's appointment was rushed and not a priority, setting the wrong tone from the beginning. Then, she failed to build rapport. Instead of taking a moment to establish a connection or ease Ms. Emma into the discussion, the doctor began the conversation by diving straight into the results. There was no effort to check Ms. Emma's emotional state or readiness to hear the news. Next, she used unfamiliar medical terms.
Blah, blah,
The doctor
blah.
explained the results using technical language that Ms. Emma likely didn't understand. Terms like precancerous changes and other jargon were delivered without simplification or clarification, leaving Ms. Emma confused about the actual severity of her condition. She provided no reassurance. When Ms. Emma sought clarity about her condition, the doctor responded in a brief, clinical manner, focusing only on the medical facts. There was no effort to provide reassurance or to explain that the situation, while concerning, was manageable with timely intervention. The interaction felt rushed. Throughout the conversation, the doctor appeared focused on time constraints rather than the patient's needs. She moved quickly through the information without giving Ms. Emma the chance to fully process what was being said or to ask questions. She ignored emotional cues. Despite Ms. Emma's visible distress and confusion, the doctor did not acknowledge or address her emotional state. The lack of empathy made Ms. Emma feel unsupported during what was clearly a difficult moment. Picking up the pieces. Watching this interaction left a lasting impression on me. I could feel the tension in the room as the doctor rushed through the conversation, and I couldn't help but notice Ms. Emma's growing confusion and fear. It was uncomfortable to see her sit there, clearly overwhelmed, without the reassurance or explanation she needed. I felt helpless in that moment, stuck observing and unsure if I should speak up. Afterward, I kept replaying the encounter in my mind, thinking about how different it could have been. It made me realize just how much communication matters, not just the words we say, but how we say them. Ms. Emma walked out of that room scared and unsure of what her diagnosis meant, and I knew that didn't have to happen. It really made me question how I would handle such situations when I'm the one in the doctor's chair. What I could have done differently. Step in to support Ms. Emma. Even as a medical student, I could have tried to support Ms. Emma after the doctor left. I could have said something like, "I know this is a lot to take in. Would it help if I went over what the doctor said about the next steps?" While I couldn't give medical advice, I could have explained the process for the colposcopy in simpler terms or at least helped her feel less alone. Ask the doctor to slow down. I know it's hard to speak up in the moment, especially as a student, but I could have respectfully asked the doctor, would it be helpful to go over what the results mean in more detail for Ms. Emma? It might have reminded the doctor to slow down and check if Ms. Emma fully understood. Future plans inspired by this experience. This experience really stuck with me and made me think about the kind of doctor I want to be. It showed me how important it is to go beyond just delivering medical facts and really focus on how patients feel when they hear difficult news. Here's how I plan to grow from this. Make empathy my priority. I want to ensure every patient I meet feels listened to and supported, no matter how busy I am. Even if it's just pausing for a moment to acknowledge their feelings or explain something clearly, I know that small efforts can make a huge difference. Practice clear, simple communication. I've realized that explaining medical terms in a way patients can understand is a skill I need to develop. I'm going to focus on breaking down complex ideas and avoiding jargon so that patients feel informed and not overwhelmed. Be confident enough to speak up. As a medical student, it's hard to know when or how to step in, but I've learned that even small contributions can help. Next time I see something like this, I want to feel confident enough to suggest slowing down or to offer clarification to the patient if I can.